chest tube. So in the Clean Utility, the kits we have are for the Atrium Oasis, which is the dry suction water seal chest drain. It looks like this. When you take it out of the package, you have this collection chamber and you have this tubing. This tubing connects to the chamber from this little port right here, and it snaps in, and then this part connects to the patient's chest tube. This will come either zip tied or have tape around it. If it comes to you and it has no zip ties or tape, then you'll want to make sure that you get some foam tape and you want to wrap it around there to secure this so that you don't have a dislodgement of the chest tube drain system. All right, then this system comes automatically pre-selected to -20 centimeters. Most orders are for -20. However, if you have an order for anything from -10 to -40, this little dial back here is what you turn to change that to whatever your order is for, but it will come pre-selected to -20. Then you have to fill up your water seal chamber. There is a little ampule on the back that comes pre-filled with 45 mils of sterile water. You just take the top off, put it inside the blue port right here, and squeeze in all the fluid, and it will fill to exactly the 2 centimeter mark. It seems strange to be putting the water in this blue port because this is also where you attach your suction, but there's a mechanism in there that distorts the suction away, so you really do just put the fluid in this blue port. Now, when you're managing your chest tube, this water seal, there should be no noise with this system. This water seal should have 2 centimeters of water. If you come on and you're checking everything and this is below the line, you're going to get a syringe with a needle attached, and you're going to insert some sterile water to bring this up to the 2 centimeter mark. And you'll do that by inserting your needle into this rubber stopper back here, and then you'll instill your liquid, and then you'll turn it around and you'll see where you're at. Okay, we need some more, so we would go ahead and add some more. And then you would keep adding till you get to the 2 centimeter mark. If you come on or if you are filling it to the 2 centimeter mark and you overfill it, you just take your syringe, stick it back here, and you aspirate the overage till you're at the 2 centimeter mark. All right, now you're also going to want to connect this to suction if the orders are for suction. Sometimes the orders are just for water seal. If it's just for water seal, you're fine, you do nothing else. But to connect the patient to suction, you have your suction tubing to the blue port, and the other end goes to the suction, to the wall suction meter, and then you'll turn it to continuous. You should have at least 80 centimeters of suction. And then you'll notice down here, there should be no bubbling at all. If you have bubbling like this, then your patient has an air leak. Notice it's just filling the one, so it's a small air leak. If it's the larger it gets, the more bubbles you have, and it crosses all the way over to the 5, and that's a really bad air leak. So if it's everything's set up fine and your patient has no air leak, you will have no bubbling in the water seal. A bubble means there's an air leak. Things that you want to watch for and on your shift, when you come onto your shift, you want to pay attention to your output, because you want to be able to notice if there's a severe increase in output or a color change. If your patient's having serosanguinous output and suddenly they're having bloody output, then we need to notify the physician. So we always want to be aware of how much output our patient's having and what the color is. We want to make sure that we have our water seal to the 2 centimeter mark. We want to make sure our dial is set at whatever the order states, which would be the -20 unless otherwise stated. And we want to make sure that our balloon is inflated to the delta mark. If you're -20 and your balloon is inflated to the delta mark, then you have your -20 centimeters of suction. Now, you'll notice I don't have suction turned on, and the little ball right here is now up to the 15 mark. If you are off suction, you are fine for having this ball travel up here. That just means the patient has an increase in their interthoracic pressure, which means maybe their pneumothorax is starting to resolve itself. However, if your ball is up here and you're connected to suction, see, when you're on suction, it should be down here. But if you're on suction and it's up here, then you want to squeeze this little button back here, and then it's going to cause that ball to go back to where it belongs. You do not have to do that if they are off suction, only if the ball is up here and they are on suction.